Hey, what's up, y'all? Good morning. Good morning, good morning. Just wanted to say the universe is shining down upon us in Colorado. Little blizzard. I don't know about a blizzard. Snowstorm, hopefully help keep some fucking people inside. Social distance yourself from the blizzard or the snowstorm. Anyways, just having a little fun this morning, goofing around. Wanted to follow up on the video I made last night, posted last night. And this is just something to, again, try to kind of give perspective on some things. I don't know, thoughts, just my thoughts again. So watching the news this morning, I saw the most recent estimates that you got about 10,000 people in the United States who have been confirmed tested positive for the COVID caused by the novel coronavirus. Novel just means new, by the way, so we're cool with that. And about 150 deaths, something like that. That was as of about 9 o'clock. I saw that Mountain Time. So when you do the math of that, you're right at that like 1.52% mortality rate, death rate, right? People who are dying from it. And so it doesn't seem like a lot, but if you do that math over however many people they say may get it, that could be a lot of deaths. But I'm going to offer another perspective on it. I'm going to argue that 1.5% is not accurate at all. Not accurate at all. In fact, I'm going to argue that the death rate in this country is less than that, at least right now. Right now. Why? Well, because I've seen estimates of the 10,000 people they say who have tested positive. There could be up to double, triple, even, 50,000 people who actually have this virus right now in this country. And so while I think that the number of deaths reported is probably pretty accurate, because when people die, it's reported and it's known, and those statistics are a little bit easier to track compared to how many people actually have the virus, right? So I'm going to assume that 150 is pretty close to right on overall. But let's say instead of 10,000 people who have it, the ones who just test positive, let's say there's 20. And that's at the low end of some of the estimates that some of the experts say, right? So if there's 20,000 people at the low end of the estimates, that cuts that, that death rate, that mortality rate to, between 0.5%, maybe 0.75%, something like that. When you get up into, if you're saying, 50,000 people may have it, it could be more. Still, with that 150 deaths, you see that percentage goes lower, lower, and lower, right? So I'm going to argue, I don't want to say argue, no, that's not the word. I'm thinking, my thoughts say this, that the virus itself is very manageable. It's very treatable. And I think that when we see these huge numbers in like Italy, right, 300, 400 people dying a day, the thing that we really need to focus on is that there's a lack of medical care because of the infrastructure of the medical system, of the healthcare system, and shortages on all the things that people need to treat these, the ventilators, the masks, and some of these other things that I have seen and heard our fellow health practitioners in the US talk about, right? And so they're saying that, man, the danger comes far more when the hospitals get overrun and we don't have the resources to treat people. And I think that's the big thing, right? That's the big thing that we have to keep in mind, is that there probably are a lot more people who actually have this virus than we know. In fact, there's probably been a lot of people with this virus for a lot longer than just this last couple of weeks. In fact, there's probably been a lot of people over the last few months who have had this virus who just thought they were sick, just thought they had a cold, a bad cold, or a flu, something like that, right? Those things that we call being sick. I think that's very real, and I think it's very important because of one thing, to keep in mind one thing, and it's just to calm our hysteria a little bit. Virus is serious. Virus can kill. But the biggest danger is when we overrun the healthcare system, because that's when the numbers are going to get worse and worse. And that's what we're seeing in Italy and some of these other countries where they're running out of resources, running out of beds, ventilators, and healthcare workers are, stressed, working beyond their limits, and they're getting infected. And that's the danger. That's the big danger. And so I just say it all to say this, is it's a way to keep perspective about the virus itself. Even if you get it, you think you have it, but your symptoms aren't crazy hard, aren't crazy bad, right? You just have, let's say, a cough, maybe a low fever, some of those kind of things, right? Let's say if 10 out of 10 is death, the worst you can get, what if you're like a 3 or a 4 out of 10? Something like that, right? Then I would just implore you to chill, to start eating healthy, drink your fluids, get your rest, those types of things. Because when we who are relatively healthy or who may have, smaller, a less reaction to the virus, when we go in to get tested and to seek medical care, we're taking beds, and we're taking time, and we're taking health practitioners away from some of the more severely ill people. And as this continues, it's only going to get worse. So my thought is this: act like you have it. Even if you don't have any symptoms at all, act like you have it. I think that's great advice, because some people have no symptoms and have it. So act like you have it and be very cognizant of, hey, I have it and I don't want to transmit it. But keep perspective, right? We have 10,000 cases confirmed, but up to 50,000, maybe even more people who have it and have not been tested positive for it, have not been tested at all, but they're okay. They haven't died. So that's good news. It's good news. And let's keep the good news rocking and rolling. So quick video about perspective, right? We know about 150 people have died in this country. We're working on getting this thing under control. We know that way more than 10,000 people have it. And the reason that the numbers are jumping so high is because we're getting people who are getting more and more testing, right? And as those tests come back, even people who don't have crazy bad symptoms, the numbers go up. And we're getting all of these people running to get tested because of the media, I believe, at least. And because it's like, you get tested, we got to see who has it. We got to get these statistics up there. And it's like, well, I get that part of it, but let's keep it real here, right? You don't go to the doctors to get tested and then they give you some kind of magic dose. They're going to tell you, go home, rest, eat good food, hydrate, and ride this thing out, and don't get around anybody. It's the people who really need the ventilators and the constant medical attention, the people who are really, really at risk for grave injury or grave harm and even death. They need those resources. So I'm saying, y'all, if you feel a little bit sick, if you feel whatever, even if you think you might have it, but you're cool, stay home. Ride it through just like you would a cold or something like that, right? Where there's no actual cure or magic pill. And that's going to really, really help curb the death rate going forward, because we're going to have increased resources by healthcare practitioners. We're going to have enough masks and enough beds and enough ventilators, hopefully, if the people who aren't suffering greatly just stay and chill. Because if you're practicing your social distancing like you should, assume you have it. And even if you don't have it, you're going to be cool. We're not going to spread it. And it just gives us that perspective of like, it's not as grave as people want to believe yet. The danger comes when we overrun the health system, the healthcare system, with people who don't actually need the care. They're just going to take up hours, time, resources, beds, people to tell them to, hey, yep, and tests tell them, yeah, you have it, now go home. And don't talk and, you know, lock yourself away and don't make contact with people and just ride it out. Anyways, quick video, only 10 minutes, not 40, not 35. But keep the perspective with this stuff, guys. Keep the perspective, right? We're going to be cool. We're going to be cool. I love y'all. Take care.